Hello everyone. I'm Dr. Hema Venkataraman. I'm a consultant endocrinologist at Apollo Hospital's Bannerghatta Road, Bangalore. I'm going to spend the next few minutes talking about a very important topic in endocrinology, that is preconception care. So, preconception care, as the name implies, it is care of a woman with diabetes before pregnancy. So, diabetes, as you all know, is a chronic condition, and it does control the life of people with diabetes in multiple ways. In children, it controls the way they play, it controls their food choices, it controls the way they eat. In adults, it controls the way they holiday, it controls the way you enjoy life, it controls the way you party. And in a woman with diabetes, in a young woman with diabetes, it also has a very big impact on how um, she plans or how she goes ahead with the pregnancy. So every woman with diabetes should actually have access to something called preconception care or preconceptional counseling. Um, it's very important that women with diabetes or children or adolescents and teenagers with diabetes are aware that once they approach a childbearing age, they should seek medical care or medical counseling for pregnancy planning. Okay. So there are some few important concepts of preconception care or pregnancy planning in women with diabetes. The first and foremost, the first mantra for preconception care is planning your pregnancy. So very often we see women with diabetes, very poorly controlled diabetes, walk into the diabetes clinic and telling me that they are 12 weeks pregnant. And the first 12 weeks is a crucial part of pregnancy where the baby's organs are being formed, where the baby's brain and the heart is being formed. And good diabetes control during that period is of utmost importance. And very often these women have missed the boat. Um, the good news is good diabetes control before pregnancy and in the early part of pregnancy can pretty much prevent a lot of complications in pregnancy. Poorly controlled diabetes in pregnancy can cause problems with the baby's organs, can cause problems with the baby's heart, brain development in the early stages of pregnancy. And during pregnancy, when diabetes control is poor, it can cause problems with the baby's development. But good control before and during pregnancy can minimize all these risks and can result in a pretty much normal pregnancy and normal delivery. So it's important that a woman with diabetes thinks about pregnancy and plans pregnancy. So what do we do in the preconception clinic? So when I see somebody in the childbearing age who tells me that she might be contemplating pregnancy and also she has diabetes, what I do a few things with her. So first and key important thing is I try and optimize her diabetes control. By optimizing diabetes control, I mean getting her blood sugars down to a level which is optimal or in the target range for pregnancy. One thing to remember is what is good diabetes control is very different in the setting of pregnancy and outside the setting of pregnancy. So if I saw a 50-year-old woman or a man with diabetes, my targets for good diabetes control are very different from my targets in someone who's planning a pregnancy and in someone who is pregnant. So it's important to come and see us, and we will offer you tools, strategies and medications, methods to help optimize your diabetes control for a healthy pregnancy. Number two, there are many drugs that are not safe in pregnancy that we use commonly in people with diabetes. And a lot of women get pregnant on these drugs, which may or may not be safe in pregnancy. So it's important that you actually see your endocrinologist and mention and take a preconception appointment so that they go through the list of these drugs and stop unnecessarily harmful drugs in pregnancy. The third thing that we also do is to make sure your other parameters, your blood pressure or obesity and other medication, other coexistent conditions are well managed for a healthy pregnancy. It's important to make sure that your blood pressure, if you do suffer with blood pressure, is well managed in pregnancy. And again, a lot of the blood pressure medications are not safe in pregnancy. So it's important to visit your endocrinologist to make sure you have a counseling session regarding these. Last but not the least, you must have heard of folic acid. Folic acid is a vitamin It's a simple vitamin that is given to a lot of women in pregnancy, but in diabetes, you give women a much higher dose, a 10 times a higher dose, to protect the baby's brain and to prevent abnormal brain or abnormalities in the brain or spinal cord formation. So women with diabetes are at a much higher risk of having, or baby or fetuses or babies whose mums have diabetes, poorly controlled diabetes, have a high risk of having malformations in the brain and spinal cord, and folic acid is proven to prevent that. So we offer you a good dose of folic acid while you're planning for a pregnancy. We optimize your diabetes control, we make sure all your other conditions are well managed, and we make sure you're not on any harmful drugs. And so it's really important that you visit your endocrinologist if you're a young woman with diabetes and you're planning pregnancy in the near or far future. This education is really important for all women with diabetes. Thank you.